Assalamu alaikum and good day to all of you. My name is Dr. Mubina Albotwala and I'm a child specialist. The other day I was talking to my friend and she said that vomiting in children is very common and it is something which the parents can handle very easily by giving them an antiemetic, that is some medicine to stop the vomiting. And I think that this is basically the attitude of, I guess, 90% of mothers. However, it is a very dangerous thing to do. Basically, self-medication itself is a very dangerous thing. This is because you're not treating the cause, you're treating the symptom. So let's talk about vomiting. Vomiting, actually, what does vomiting indicate? Vomiting indicates that there is something wrong in your system, as a result of which your body is reacting to it and it sort of reacts in the way by vomiting out. What are the causes of vomiting? The causes of vomiting in infants and children are many. The most common cause is indigestion or gastroenteritis. Now, gastroenteritis is a condition in which the body reacts to germs in the digestive system, and the first symptom is vomiting. For the first 24 hours there is vomiting, which is then followed by diarrhea. And this type of vomiting, this projectile continuous vomiting, is very dangerous because it can lead to dehydration. That's one of the most common causes of vomiting. The other cause of vomiting in newborns and infants is gastroesophageal reflux. That is, once you feed the child, within a few minutes or half an hour, the child vomits out everything. This is because the sphincter between the esophagus and the stomach is very weak and the child does not retain the milk in the stomach and it comes out in a projectile form. In this condition, the child generally does not gain weight. What are the other causes of vomiting? And you will be surprised. One of the other causes of vomiting is urinary tract infections. Urinary tract infections not only produces urgency of urination, micturition as we call it, but it also causes continuous vomiting. Another important cause of vomiting is throat infections, tonsillitis. It does not actually produce vomiting as such, but what it produces is that the child is either unable to swallow the food or it swallows the food with difficulty and immediately vomits it out. And the mother comes complaining to the doctor that the child has vomiting. Septicemia. Septicemia means infection of the whole body. This is very common in newborns, infants under 6 months of age, or infants less than 1 year of age. And in septicemia, the child does not take food, does not like to take milk. There is reluctance to feed, and whatever you give, the child vomits out. In these conditions, the color of the vomit is very important also. In gastroesophageal reflux, it's the milk which comes out. In septicemia, first you start getting watery vomit, and then the color of the vomit changes. It changes to yellow, and yellow vomit is a bit risky. It's a bit dangerous. Sometimes the child starts bleeding inside the GIT, inside the stomach. Then the color of the vomit changes to red. If it is frank blood, it becomes bright red. If it is blood which has gone on inside, it becomes dark red in color. Another thing is obstruction to the biliary tract. In this case, the vomit becomes green in color. If there is obstruction or subacute obstruction to the gastrointestinal tract, it basically leads to continuous vomiting, and that is a very dangerous condition requiring either immediate hospitalization or surgical intervention. Another important cause of vomiting is hepatitis. In hepatitis, the child feels like nauseated and continuously vomits out. Thus, there are many causes of vomiting, and it should not be taken very lightly, and just giving an antiemetic or a drug to control the vomiting is not the answer. The answer is to find the cause and treat the vomiting, and then go ahead with it. And for that, you need to consult a doctor. Maybe in one of the next videos we may talk about how to treat the different cause, although that is a doctor's job. But still, I think parents should know that vomiting may be due to other causes. Thank you very much.